quick question about the 340B drug pricing program. Been a big issue in Richmond this week because of the New York Times story about Bon Secours Richmond Community Hospital. Do you think that the reporting that the New York Times done and the follow-up reporting that has it raised any issues for you, or things that you would like to see Congress do to put more oversight on that program?
Michael, the New York Times story and then follow-ups in the Times and that you guys have done have raised a lot of really tough questions. And it's unfortunate because, let me start off by saying, the 340B program is really, really important. I traveled around the Commonwealth during our August recess and had a number of meetings with free clinics and federally qualified community health centers. And they said to me, look, we could not serve our low-income populations if it were not for the 340B program that enables us to get pharmaceuticals at discounted prices. We just couldn't do it. We just couldn't do it. And so they were telling me, we've got to maintain this program. There have been opponents of this program, including pharmaceutical companies. They don't like having to discount prescription drugs for low-income people, and they'd rather not do it, but the 340B program at least requires that they do it. However, the question that the reporting about Bon Secours raises is, when hospitals providing services to low-income individuals are able to use the 340B program, do they use the savings that they gain to help low-income patients or not? So I think the questions that are raised are less about, is it important to have a program that can discount drug prices to low-income people? The question is, are the entities who are getting those discounts using it to really help low-income people? With respect to free clinics and the federal community health centers, we know the answer to that question. Hospital chains that are not nonprofit hospital chains that serve a lot of different people, we may have to get a little more information and transparency about how those hospitals are using the savings to make sure that they really are using it to benefit low-income patients.